Okay, I'm going to start. A very good morning to India and very good evening to USA. Namaste everyone. I am Vaidya Pragati. I would like to welcome you all to the GCAR's Global Webinar Research Series. Some of the housekeeping rules. I request you all to mute your microphone when not speaking. Please use the question and answer feature for questions. Please raise your hand virtually if you want to speak. I would like to give a little bit introduction about Global Council for Ayurveda Research Global Webinar Series. The main motto of this Global Webinar Series is to encourage, educate, and facilitate basic clinical and interdisciplinary research in Ayurveda. Our vision is to promote and establish Ayurveda as an evidence-based health science globally. You can learn more about us at www.ayurvedaresearchusa.org. Please do consider joining us as a member, which will bring you access to all our resources. And GCAR, as no nonprofit, can operate and succeed without volunteers. So please consider joining us as a volunteer, and we can place you in a variety of projects based on your skills and interest. Once again, our website is www.ayurvedaresearchusa.org. Now, I would like to introduce you to our eminent speaker, Dr. Lalith Kumar ji, who is a distinguished practitioner in integrative medicine with a profound focus on holistic cancer care. His expertise and extensive experience in integrative and preventive medicine have led him to become a beacon of hope for numerous individuals navigating their journey through cancer. With a master's in Ayurveda and alternative medicine, Dr. Lalith Kumar ji stands as a compassionate healer, specializing in empowering cancer patients through a comprehensive approach to healing. Over the course of his career, he has treated a significant number of cancer cases across India, applying an integrative methodology that encompasses various healing modalities. His profound dedication to cancer care extends to utilizing diverse therapeutic approaches, including Ayurveda, naturopathy, ozone therapy, chelation therapy, IV nutrition, and IV vitamin C therapy. His approach is holistic, focusing on supporting the overall health and well-being of patients while working in conjunction with conventional medical treatments. Dr. Lalith Kumar ji's commitment to integrative medicine and his compassionate care has made a significant impact on the lives of cancer patients. He stands as a supportive guide, provided personalized compassionate care and empowering patients to navigate their healing journey with a sense of hope and resilience. I warmly welcome you, Dr. Lalith, for our GCAR's Global Webinar Series. Over to you.
Thank you. Thank you. Am I audible to all?
You are. You are.
Yeah. Thank you, first of all, Global Council for Ayurveda Research and all the volunteers.
Sorry to interrupt. Yeah.
Yes.
Go ahead.
Okay. So once again, thank you all the board of directors, GCAR, and also the volunteers for giving me a wonderful, which is my passion also, and a wonderful platform. And it's my pleasure and honor to be a part of this platform. And of course, a very emerging and, the really, especially in this field, which I was looking for. And this is the beautiful platform for updating ourselves and also the, science. Okay. And Shall we start the presentation?
Yes, yes, Lalith.
Yes.
Go ahead.
Okay. Yeah. So myself, Dr. Lalith, as Dr. Pragati introduced, I am basically MD Ayurveda and MD in alternate medicines. Okay. Why I selected this topic is because cancer is a multi-dimensional disease. Okay, where only if you control the disease, it may not give good quality of life or the nutrition to the patients. So here we have to focus on multiple things as the disease itself is a multidimensional. Okay. So how much importance we look for controlling the disease. Similarly, we also look for some wellness or the well-being of the patient, or we need to give them a holistic approach in order to have a successful outcome. Okay. So cancer is one area where the disease can be controlled with the modern medicines or the available conventional treatment, but because of the side effects, toxicity, and because of the immunosuppressions, always there is, a more number of percentage of failure cases, even with a complete, modern medication. That is where our Ayurveda and these integrative medicines and holistic approach and complementary and alternative therapies plays a vital role in successful results and a successful prognosis of any cancer patients. Okay. So, uh, are you able to see any slides?
Not yet. Can you please share?
Yeah.
Uh, Give me a moment. It takes at least few minutes. Not yet, Lalith.
Just a minute.
You want me to share?
Better if you can share, it will be good.
Okay, wait. Let me
Yeah.
share. So you're able to see my screen?
Yeah.
Good. Yeah.
Yeah. So this is the topic which today's presentation is empowering wellness. So more than focusing only on controlling the disease, we have to focus on the wellness of the patients, where definitely the integration of the certain treatments are necessary. Next slide. Yeah. Why we need integration of treatment is because cancer is, as I said, it is a multi-dimensional disease with multiple symptoms and multiple prognostic factors. Like, cancer is not only the cells are multiplying abnormally and abnormal growth of cells. Cancer is also a inflammatory disease. Cancer is also because of the, toxicity. Cancer is also because of the, a wrong lifestyle and the wrong diet. So basically, it is a syndrome where you see that inflammation, where you see that tumor burden, where you see that microbial load, along with that, the liver dysfunctions, enzyme dysfunctions, loss of appetite, and there is impairment in the metabolism and suppression of the immune system. So there are multiple things involved in the prognosis or the pathogenesis of the disease. So here, more than focusing on controlling the disease, along with controlling the disease, if we focus on something holistic to prevent all these, control the inflammation, improve the appetite, and to improve the metabolism, to boost the immune system, there will be a successful prognosis and the better outcome of any cancer treatment. And second thing is, as majority of the cancer drugs which are available in the conventional medicines are immunosuppressive. So once we try to enhance the immunity, the treatment outcome also will be better and the toxicity also will be less. Third thing is to achieve better quality of life. Successful cancer treatment only we can call when there is a control in the disease and with the maintaining optimum quality of life. But majority of the time, the successful controlling disease may not give the optimum quality of life. That is where we need to interfere with the wellness treatments or alternate therapies or holistic approach, and also to minimize the side effects. As we know, whatever the conventional cancer treatments available today comes with lot of side effects or even minimum side effects, but the longer the treatment, the side effects will be more and much more. So to minimize the side effects, we need to have these kind of therapies. Better prognosis. Once the nutrition is good, once the side effects are minimized, once the immunity is boosted, automatically the prognosis will also become better and improve the treatment outcomes. So once we give the conventional cancer treatments, majority of the times it has other side effects which will damage the blood levels, low WBC counts, platelet counts, or anemia. So in order to improve the treatment outcome, we need to have this holistic approach and also the long-term survival, improve the nutritional status of the patient, well-being patient, and better control over the disease. So when we look at it, all these parameters, only chemotherapy, radiotherapy, and surgery may not be sufficient to achieve all these things in the cancer patient. And to have a successful treatment, we need to focus on all these things. Then only the disease also will be controlled with reduced side effects and better quality of life with optimum enhancement of the immune system so that the patient will be normal with the long-term survival with good prognosis. Next slide. Yeah. So, other than chemotherapy, radiotherapy, surgery, there are good lot of wellness anti-cancer therapy, and usually which I practice for my cancer patients is detoxification. That is, we have Ayurveda Panchakarma therapies like at least Sadhyo Virechana, Sadhyo Vamana, or classical Vamana, classical Virechana, along with that Basti. And second thing is ozone therapy, which is considered to be one of my powerful weapon in beating the cancer. And high dose vitamin C therapy. Again, this is both ozone and vitamin C. It has been giving me a very significant improvement in my cancer patients. IV nutritional therapy, antioxidant therapy, anti-aging therapy like Rasayana therapy, what you call Rasayana Chikitsa in Ayurveda. And along with these IV treatments and therapies, patient has to be kept under some of the immune boosters like curcumin, amla, yastimadu. There are a lot of Ayurvedic herbs, shilajit, okay, so which boost the immune system and control the disease. Next slide. Yeah. So as we know, ozone therapy. So ozone therapy is a medical treatment that uses ozone gas to treat the different health issues. This is like a one medicine which does 100 jobs in the body, or it benefits in 100 ways to the cancer. In further slide, I will be explaining how this ozone therapy can help as a multi-dimensional approach to the cancer. Okay, it is one of the very powerful multi-dimensional therapeutic tool, especially in cancer patients. So to brief, ozone therapy stimulates increased oxygen flow to the targeted areas and promotes healing by its anti-inflammatory property and increases the antioxidant oxidant enzymes to fight against the oxidative stress. Okay, next slide. See, these are the few benefits which we can see. So one is it's a very powerful anti-inflammatory. Of course, it stimulates the antioxidant enzyme, so it can be, one of the anti-aging therapy, anti-aging tool, and it is a powerful cellular rejuvenator. And ozone therapy, since it disintegrates when it is given into the body, when it interacts with the blood, it disintegrates into O2 oxygen plus nascent oxygen. So this nascent oxygen being a very powerful antimicrobial, so ozone is considered to be one of the very powerful antimicrobial, and it boosts the immune system. So stimulates the immune system by multiple blocking the cancer pathways. And it is considered to be one of the very powerful antioxidant. As you know, it reduces the oxidative stress, improves the tissue circulation, blood circulation, and also the oxygen circulation. And it can be a pain reliever and improves the tissue oxygenation and increases the metabolism. So these all benefits are required for our cancer patients. So one ozone molecule, when it given with the proper dose, with the proper frequency, you can imagine the amount of area or the amount of benefit what we are giving to the patients. Okay, so this is considered to be one of the powerful therapy and powerful tool which I personally see a significant improvement in my cancer patients. Next slide. So chelation therapy, as we know, it is used, probably around 50 to 100-year-old in terms of, to remove the heavy metal toxicity. And current researchers says that it is benefiting circulation to the heart and reducing the, plaques and reducing the blockages and all. But according to me, even though the hard calcified blocks are not removed, but it makes the hard blocks into the soft, and it improves the, circulation to the heart and blood supply to the heart muscles. Along with that, it has a very beautiful mechanism that it helps in neoangiogenesis, which develops a collateral and a new blood vessels, which can, supply a proper amount of blood supply to the heart. Okay. So this therapy and used as a complementary therapy for people with coronary artery disease, and also helps in diabetes, non-healing wounds, peripheral artery disease, and also, lowering the sugar levels and improving the blood circulations where the, circulations has been hampered. Okay, next slide. So during my, earlier practice days, when I see that why the, because of the lot of side effects, and when I was doing continuously research on cancer, I found that many of the anti-cancer drugs which are available in the conventional medicines are derived from nature, that is from the plant source. Okay, so when plant source has that much potency to control the cancer, control the disease, why can't we do it the same in Ayurveda and complementary and alternative medicines? So this led me to do more and more research and come out with the new molecules, and do, when it can happen in allopathy, why it will not happen in Ayurveda or alternate medicines? Even though our treatments are very safe, without any side effects, natural, it doesn't damage any organs, and it is, it doesn't never go against the body's physiology. When we have so many areas to focus in the body without damaging it, why we can't give results in any of the cancer patients? So when continuously doing the research, I found that majority of the anti-cancer medicines, which earlier we used to use in conventional medicines, like vinblastine, vincristin, etoposide, paclitaxel, and all these flavoperidol and irinotecan. If you see, this majority of these drugs are origin from the plant source. Okay, so this is all extracted, but the source is the plant source. So when this can control the disease, why not our Ayurveda, or why not our therapies or alternate therapies can control the disease? So since then, I started my journey towards the cancer. I researched with multiple available therapies in the cancer, multiple herbal molecules, Ayurveda, naturopathy, homeopathy, and the integrative approach and the synergistic benefits. That is how I started started my practice applying 1-1-1-1, therapies, and that is how I got, a significant results, and my practice has been, picked up. Next slide. So basically, again, if you see the strength of Ayurveda, preventing disease or reversing disease is always better than suppressing symptoms or just treating symptoms. Okay. So majority of the time I get the cases where patients are taking, so 80% of my cases are oncology cases, and 20% of my cases are, very chronic degenerative disease, where patients are fed up taking allopathy medicines, but still the problems are existing. The only problem with allopathy medicine is it is always they suppress on the, they focus more on the symptoms, and the symptoms are suppressed, but the root cause is not addressed. So the strength of Ayurveda or the integrative holistic approach is we focus on the root, and we try either to prevent the disease or to reverse the disease without damaging the body. So this is always better, preventing or reversing the disease than rather suppressing or just treating the symptoms. And this is always a, curative approach. So next. So now a few slides, let us talk about what is the main reason for the cancer, and why we have to prevent it more than, curing, because cancer, as I said, multidimensional disease, and curing always depends on the patient and also on the doctors. Okay. And also on the approach. If I am not able to manage the cancer holistically, always either there will be a, failure in the treatment, or we may not get the expected results. So always we should focus either, if it is possible to prevent the cancer, let us prevent it. Otherwise, if we want to treat it, we need to have multiple approaches, we need to integrate multiple systems, and then if we treat it, definitely cancer is curable, and definitely we can have a better prognosis with improved quality of life and long term survival. That is why this further slide, few of the slides, let me talk about, how we can prevent the cancer and what are the simple things which can cause the cancer. Next slide. So many a times, a lack of awareness or lack of knowledge regarding the cancer, we may fail. Many a times we blindly trust the oncologist, and even though oncologists will do their best to treat the cancer or control the cancer, but today the available cancer drugs comes with lot of side effects and lot of immune suppressions, lot of toxicity. Therefore, that is one of the limitations in conventional medicines. That's why we need to have some knowledge regarding the cancer and some knowledge regarding how to prevent it. And if the cancer is already occurred, then we need to have some knowledge regarding the complementary or the integrative therapies to have a successful control over the disease, and also to promote the knowledge regarding the cancer fighting diet, because how much the treatment is important, equally our lifestyle is also important, and cancer fighting diet is also important, because even though treatment is good, but our diet and lifestyle is feeding the cancer, the outcome is not great. Okay. But if the treatment is good with a healthy lifestyle and a healthy diet, the outcome is significantly, it is promisable. So, and along with the cancer, having a knowledge, we being a Ayurveda graduates and Ayurveda practitioners in cancer, we have a good lot of scope, because always allopathy doctors, they always focus on chemo, radio, and surgery, but very few doctors, they focus on the wellness approach or integrative treatment. But we being a Ayurveda practitioners, we have a good scope to focus on multiple therapies like, Ayurveda, naturopathy, complementary and alternative medicines, integrative systems, like as I said, ozone, high dose vitamin C, giving some IV nutritions, panchakarma therapies, and rasayana chikitsa, all those. Okay. So next slide. So majority of the time, the causes of the cancer can be divided broadly into the four types. One is diet, second is lifestyle, third is environment, and fourth is family history. Okay. So we along with treating the disease, we need to correct this. Okay. Eating more junk foods, sugary, high calorie foods definitely has an impact on the cancer and definitely has impact on the inflammation. So diet plays a major role in slowly, inflammatory pathogenesis. So once the inflammation in the body is building up, slowly after a few years or over the time, it can definitely convert into the cancer. So diet, lifestyle, environmental faculties and family history plays a very important role in pathogenesis of the cancer and also to control the cancer. Next. So again, coming to, a different classification, like, biological classification, physical classification, chemicals, so mainly the biological, taking too much of the drugs and taking alcohol, smoking, and again, chemical classification, exposure to too much of chemicals, example like, paint and pesticides, all those things as definitely has an influence on multiple type of cancer, including the lung cancer. Next. Radiations. Yeah, nowadays, a lot of, high frequency, magnetic frequencies, electromagnetic radiations, Wi-Fi's and towers, mobile radiations has lot of influence on, mainly on the brain tumors like, glioblastoma, medulloblastoma, and lot of, brain tumors. So this has been, they say that, the high raised mobile towers and the 100 meters, the residents within the 100 meters surroundings of the, the people are more likely to affect with the, either the degenerative disorders of the brain or the brain cancers or the brain tumors. Okay. Next slide. Yeah. So simple preventive measures, which comes in part of, lifestyle. We need to be very active with a little bit of physical activities like yoga, pranayama, avoiding obesity, healthy dietary practice. The why healthy dietary practice is to keep our metabolism very active, to reduce the inflammations as much as possible, to keep a optimum BMI and reducing the obesity risk and to manage the diabetes, hypertension, all these things. So definitely, we need to have a healthy dietary practice and reducing the occupational or environmental exposures or taking necessary precautions to avoid its impact on health. This is the area where our Ayurveda plays a very important role. Okay, either if it is unavoidable, we can work in such a atmosphere where it is having some health hazardous or having a bad impact, negative impact on the health. But definitely, we have all the scope to come out of it. We have all the scope to take necessary precautions to avoid its negative impact on the health. But this scope is not there in allopathy because we cannot prevent anything through allopathy, or we cannot have something wellness or regeneration or rejuvenation of the health through allopathy. Okay. So reducing the alcohol consumptions, reducing the exposure to pesticides and all the chemicals and all, and avoiding tobaccos. So definitely having all these, together, we can definitely reduce a good number of percentage of risk, and we can avoid the cancer. Next. Body weight. So having, a optimum body weight, healthy body weight, because, obesity is considered to be one of the major risk factor for multiple type of cancer, like, stomach cancer or, cervical cancer, ovarian cancer. And obesity also has a, root cause for majority of the health disease like, diabetes, hypertension, etc. So keeping a healthy weight is one of the important factor to be considered in order to, maintain the cancer. I mean, maintain the, to reduce the risk of the cancer. Okay. So it's better to be as lean as possible, and having a healthy activities, physical activities. Next slide. Foods, avoiding the foods and drinks that promote a weight gain. Okay, so limiting the consumption of energy dense foods, avoiding sugary drinks. They say that energy dense fruit and acidic foods and sugar rich foods always triggers the inflammations in the body, and inflammation is the first criteria which triggers the cancer pathology or the cancer pathogenesis. So avoiding high calorie foods, sugary drinks, and acidic foods always, a better option in having a healthy, to maintain a health and to prevent a risk of the cancer. Next slide. And also, this preservation, processing, and the preparation method of different food items. Okay, not only the quality of the food, along with the quality of the food, how we cook the food, how we prepare it, how we preserve it, and what the things we add to the food during the cooking, like everything, coloring agents, artificial flavors, or processings. So all these, on day-to-day basis, always it triggers the inflammation, and somewhere it increases the the diabetic risk and also hypertension risk. Slowly it can lead to stomach cancer or multiple GI cancers. Okay, next slide. Physical activity. So they say that there is one study is done that having a healthy physical activity, or people who involves in routine physical activity in day to day life, it releases some enzymes which has a anti-cancer property. Okay, so keeping a optimum physical activity, and keeping away from the sedentary life is always a better option. Next slide. Dietary supplements. Okay, this is mainly aim to correct the nutritional deficiency when the our occupation is in such a way, we have lot of stress, where we cannot avoid the atmosphere, we cannot avoid the stress. And definitely we have some of the therapies in Ayurveda like Shirodhara to control the stress. We have always few of the rasayana drugs or the rasayana therapies which to come out of the nutritional deficiency, and we can always keep our immune system active by taking some of the supplements without damaging the body, so that our immune system is active and our immune system keeps on fighting against the microbes, so that we can avoid the recurrent infections, and we can avoid the inflammation, thereby we can control the cancer. Next slide. Eating mostly foods of plant origin, because many a times, as I said, processed food, preserved food, and a high calorie foods, always they are acidic in nature. So once routinely if you consume, or the patient consumes the acidic food, it triggers somewhere the inflammations in the body and the infections in the body. So keeping the system very alkaline, and the majority of the plant foods are alkaline in nature, and along with they have multiple activities which I will be explaining in the further slides, how plant foods are helping in controlling the cancer. So the main focus or the main advantage of taking plant foods is the majority of the plant foods keep the system alkaline, and they are fiber rich foods, keep our gut healthy. So again, this is one of the best option, to prevent, to keep our immune system active and to prevent the diseases. Okay, next slide. See, what is a plant-based diet is, consuming a whole food plant-based diet is centered on whole, unrefined or minimally refined And considering, consuming fruits, vegetables, legumes, tubers, whole grains, which is a fiber rich foods, alkaline foods, and minimizing all the processed, preserved, and additives, and meat or dairy products, and highly refined food, or highly sugar based foods, and refined foods. So all these things trigger somewhere the pathology in the body. So plant based diet is one of the good option to prevent the cancer. Next slide. Next slide. See, the importance of plant-based diet is it is not only a alkaline food, okay? It lowers the cholesterol, it lowers the blood pressure, it controls the diabetes, and it prevents the heart disease, healthier weight. It is a fiber-rich food, okay? And it improves the healing mechanism. And when all these properties are there in the plant-based food, it slow down the inflammation, and many a times if already the disease is there, it reduces the progression of the disease and progression of the sometimes different type of cancer. Thereby it controls the inflammation, it improves the antioxidant activity in the body, and it reduces the progression and the metastasis of the disease. Okay, so it is not only about the a single entity where we are focusing by having a plant based diet. It has a multi-dimensional approach which are essential to control the disease like cancer, since the cancer is also a multi-dimensional disease. Next slide. Phytochemicals. So usually plant-based food has a phytochemicals. So these phytochemicals, as I said, especially when we consider as a cancer, in a cancer, how these phytochemicals help is, one is the main important thing is stimulates the immune system. I usually tell my patients that in a cancer, the first and foremost important thing to look after is our immune system. So when we take care of the immune system, our immune system will take care of us. If we damage or spoil the immune system by our own negligence, by improper, unhealthy diet, lifestyle, and consumption of alcohol and tobaccos, then medicines can control the disease, but definitely we will not get a successful treatment. We will not be able to give them a long-term prognosis, good prognosis, and survival. That is why any treatment, any disease, including the cancer, stimulating immune system or focusing on the immune system is one of the main approach in my practice. And this is being considered to be, giving a good, healthy quality of life along with controlling the disease, and block what we eat, drink, and breathe from becoming a cancer producing substance. Okay, so these phytochemicals making our system alkaline, it blocks majority of the things in the body which can convert into the cancer, or which can trigger the inflammations, which can create a radical free radicals in the body, and which can stimulate the oxidative stress in the body, that can be blocked by taking these phytochemicals or plant-based foods. Okay, and as I said, reduces the inflammation. Alkaline foods, plant-based food, considered to be one of the best way of reducing, inflammation, and prevents the damage, DNA damage. If already it is damaged, it helps in stimulating the DNA repair. So that is why they say that only the alkaline foods and plant-based foods can repair, rejuvenate, and regenerate the body tissues. None other things which you take orally can, either it can repair, but none of the things can regenerate or rejuvenate. Okay, so reduces the damage to the cells. Okay, so it doesn't only repair the DNA, it also reduces the damage. And it also, because why, how it reduces the damage is because this will help in stimulating the tissue recovery, and thereby it reduces the DNA damage, and it repairs the DNA damage, and it rejuvenates the body tissues and the cells. Okay, and triggers the damaged cells to die. When the cells are about to die, they will die, but these phytochemicals stimulates the generation of the new cells, okay, and slow down the cancer cell growth rate. When you keep your blood alkaline, when you control the inflammation, when you keep your system alkaline, that itself will control the cancer. We don't have to go for the treatment at all. So once we focus on boosting the immune system, keeping the system alkaline, by there itself, you will control the disease by 20 to 30%. Okay, and helps to regulate the hormones. If there is a hormonal imbalance, taking this a phytochemicals or plant-based diet, not only it has a influence physically on the body, it also cleanses our mind, it also regulates the hormone, and it also clears the so it always focuses on the mind, body, and the soul. Okay, so that is why we say we are what we eat. Okay, so that is how these phytochemicals will help in multi-dimensional approach. And if you look at uh, these all have influence on the cancer. If you suppress the immune system, if the body is producing more of inflammation through the diet and the lifestyle, if our we have something DNA mutations in the body, and if there is some destructive processes going on because of our diet, inflammation, or because of our occupation, because of our stress levels, and there is good lot of hormone imbalance, then definitely the prognosis, I mean pathology of the cancer begins there. So having on daily basis, detoxifying ourselves, keeping our immune system active, definitely thereby we are preventing the cancer, and we are controlling the cancer, and we are reducing the aggressiveness of the cancer, and we are preventing the cancer from spreading earlier and damaging other organs. Next slide. So again, these phytochemicals not only do these many benefits in the body, but also it corrects the deficiency, and it also gives good nutrition to the body. Okay, and why nutrition is important? Suppose if to tolerate chemotherapy or radiotherapy well, the body or health also should be in a good condition. If my immune system is very active, my immune system is very strong, I control my therapy will control the disease effectively without much side effects. Otherwise, if my immune system is weak, even though I have a lot of side effects, but I may not have desired result or control over the disease, or even if I have a control over the disease, but it is only a limited period of time. This is because of lack of nutrition. So having optimum nutrition is also a important factor which we need to consider during the cancer treatment. And why we need to focus on optimum nutrition? Because cancer patients always come with a impaired metabolism. Either they will have a loss of appetite, they may not be able to eat like how they are eating before, and weight loss, and because of the stress, body will be under stress, their mind will be under stress, all the cells will be under stress. So all these things which will result in impaired metabolism, so which leads to ultimately improper absorption of the nutrition. So when there is improper absorption of the nutrition, slowly the patient will be ending into the malnutrition. And once the malnutrition is there, none of the cancer therapies will give a desired result. Okay, so always we should consider that keeping a optimum nutrition so that patient is not going towards the malnutrition, and keeping the nutrition intact, treating the cancer with a different modalities and integrative approach, we have a better outcome. Okay, and also maintaining optimum nutrition helps in better and early healing progress. This nutrition not only help in reducing the side effects and giving some efficacy to chemotherapy, but also it stimulates your own body to have a early healing of the disease. Okay, next slide. So again, and this nutrition will help in improved quality of life and fewer complications. Whereas you can see that the reduced nutrition or malnutrition or cancer cachexia, what we call, will always have, reduced survival, poor prognosis, less response to the treatment, and significant malnutrition also can cause, mortality. And majority of the time, we see in my hospital that lot of, after a continuous chemotherapy, patient will end up with cancer, cachexia, and malnutrition, and malnutrition can lead to a mortality. Okay, so to, reduce the toxicity, and to reduce, to improve the quality of life, and to, have a better efficacy and control over the disease, again nutrition is, one of the very important vital element which we need to look into it during the cancer treatment or the cancer journey. Okay, next slide. Yes. Coming to now the actual my clinical practice starts. So this is one of the my, a hardcore principle or the approach where I treat my entire cancer patients. So you might have heard of Otto Warburg, who has, received a Nobel Prize for discovery that no disease, including cancer, can exist in an alkaline environment. So this has given me, this is a eye opener for me in terms of approach, with integrating lot of cancer treatment. Okay, and this concept I follow in diet also, and treatment also, and in all the cancer patients also. Okay, so I know there is a research saying, next slide, please. So you can see that previous. So you can see that these are the blood samples. Majority of the time, when I collect the sample of the blood, I mean patients' blood who are affected with, lot of inflammation, cancer. Usually, you see that their blood will be dark color, who has a high CRP level or HSCRP level. But when we make the blood alkaline, you see that CRP is controlled, HSCRP is controlled. It boosts the, antioxidant enzyme. And this is the color of the blood which I see before ozone treatment and after ozone treatment. Okay, so before I start my treatment, the color of the blood will be like a used engine oil. Okay, when we take a vehicle, when we put a new oil, it will be little bright red. But as we use our vehicle, slowly when the oil is used or exhausted so much, you see that oil is turning black. Similarly, in our body also, we have a blood which is, usually in Ayurveda, we say that rabbit blood color. Okay, when we born or when we take birth, if you see the color of the blood, it will be exactly like a rabbit's blood. Okay, and over a period of time, probably because of the excessive stress or diet or lifestyle or our, lifestyle, slowly the accumulation of the toxins in the blood lead to the, a lot of inflammations in the blood and reduced alkalinity in the blood. Usually our blood will have, pH of 7.3 to 7.4. Okay, but when you see that the inflammation process is going on in the blood, you see that slowly the blood is tending to acidic levels. And when the blood is tending towards the acidic level, that is around, 7.2, 7.1, it is a favorable atmosphere for the microorganisms to multiply. Okay, because there the oxygen is not perfusing into the blood cells properly, and increase in the acidic level and increase in the inflammation level. Okay, so this gives favorable atmosphere where the virus or the bacteria or the fungus or the microbes will start growing and multiply in faster way, and they lodge in one of the specific organ, and there the cancer pathology starts. Similarly, when you give ozone therapy, it increases the tissue oxygenation level. It improves the, what you call antioxidant enzyme. And when the oxygen is rich in the blood, you see that the blood viscosity is reduced, color is reduced, and blood can free. I mean, it can penetrate into the, targeted areas easily, so that you are reducing the inflammation, thereby you are blocking the disease or you are blocking the further progression of the cancer. Okay, so This is being one of the my hardcore, approach for the any cancer treatments. Next slide. So this is one of the, one of the research journal of nutritional sciences, where they have seen that, reducing the dietary acid load lowers the cancer risk. So that is why I said, if you have a two sets of food, one is processed, preserved, frozen food, and all artificial food, preservative based food, excess sugary drinks, carbonated drinks, and excess eating non-veg. In the other hand, more of plant-based foods, phytochemicals or fiber-rich foods and alkaline foods, taking a healthy fats, okay, avoiding the refined oil. So this category has increased the acid load in the body. But the latter category, alkaline food, reduce the acid load, make the system alkaline, thereby prevents the inflammation and thereby it prevents the lot of disease and reduces the risk of becoming a disease or becoming into a, active disease pathology. Next slide. So the vast majority of the disease can be prevented and even cured with excellent nutrition. Food is the safest, most effective medicines. Even though in today's era, the food or the diet is one of the ignored area. But 99% of my patients, I advise diet as a first, approach. Second is the lifestyle, and third is the medicines. Okay, so I give my patients 3 months of time with a diet, with a lifestyle, and with a few of the supplements, so that I don't want to see the same problem repeating after 3 months. So when you give this holistic approach with the diet, with the lifestyle, and few of the therapies which is really needed, so definitely it is a curative approach, and you can control the lot of disease, and you can give good, a promisable result to the patients and a significant relief in terms of the symptoms. Next slide. So every time you eat, it's an opportunity to nourish your body. So it's up to our end. Again, I tell my patients that, majority of the disease or majority of the problem in our life is, it is purely because of our ignorance or our abusions to our body or our negligence. So when we neglect our body, when we damage our immune system, when we don't take care of our immune system, definitely the disease pathology starts. So it is not on the doctor's hand to completely cure the disease, but equally, even we are responsible, patients are responsible to have a, optimum nutrition through diet, healthy lifestyle. That is how we nourish our body. Okay. Next slide. So this has been told very long back in our Ayurveda. So that can be, stated very well by this sloka that Nityam Hitara Vihara Sevi Samikshakari. I hope everybody understand the meaning of this. So indulging once every day in Hita Ahara and Vihara Sevi Samikshakari, obedient, Vishayeshu Asaktaha, without any so much attachment to the materialistic world, Data Samaha, one who donates, Satyaparaha, one who speaks truth, Kshamavan, one who forgives, Aptopasevi, one who listens to the elders, Bhavati cha arogaha. Okay, so in this, one of the main factor is Nityam Hitara Vihara Sevi. So those who indulge in Hita Ahara and Vihara, they are less likely to suffer from these small diseases like, chronic gastritis or even diabetes, sugar. When we are preventing the small diseases then and there by adopting a healthy lifestyle and the diet, definitely we are not allowing this small disease to become a big disease, and thereby we are preventing all the major disease. Because once the major disease comes by ignoring our body, immune system, everything, again we have to go back to the treatment, and again treatment, along with the treatment, again we have to come back to the diet and the lifestyle. So having routinely a healthy lifestyle diet is one of the better option if we are looking for a curing or controlling or preventing or minimizing the side effects or improving our survival or to become a, to have a good prognosis over the treatment. Next slide. So now let us talk about the practical things which clinically how I am treating my patients. What are the few of the Ayurveda herbs I am using majoritarily, and what are the nutraceuticals ingredients I am using for my cancer patients, and how I am treating, and what are the amazing results I have got in my patients within a short duration of time, which even chemotherapy or radiotherapy may not be able to do it or achieve. This is only because of, there are three, four things which I will be telling you end of the slides, how I approach the patients and what I look in the patients to have a effective cancer treatment. So these are the commonly prescribed herbal extracts like guduchi, which is, we know, the active principle terpenoids, giloin, which in that I use giloi sattva and amrutarista, amrutotara kashayas, and this is, botanically it is called Tinospora cardifolia. Curcumin, again, curcumin is considered to be one of the, very potent anti-cancerous in Ayurveda and the nutraceuticals, and it is one of the powerful anti-inflammatory because of the curcuminoids. Grapeseed extract, which I use widely in my patients, which has, resveratrol, polyphenols, proanthocyanidins, which is a very powerful antioxidants and anti-aging therapies, which improves the microcirculations, okay, and reduces the oxidative stress. Other than that, ashwagandha, which, reduces the stress hormones, and, which has a vithanolides, which can be considered as a powerful adaptogen. Okay. And white mulberry leaf extract. This is a recently, it is a very long, we have extracted from Morus alba, which is called white mulberry leaf. And from that, we have extracted the sodium copper chlorophyllin, which we used to use very long back. And if you go through the history, it has a long back years of history of using sodium copper chlorophyllin for a lot of immune related disease. But now we have researched and we have come out with a new product, and I have been using extensively for, breast cancer and also the brain tumors. And also this works beautifully in terms of, increasing the platelet count, WBC count after the chemotherapy. Once we give chemotherapy, all our, hemoglobin drops down and the platelet WBC drops down and the bone marrows become suppressed. Okay. So this is considered to be one of the, important ingredients where I used to manage the vital elements and the blood parameters. And rice oryza sativa. There is one orabixanol compound which is it is yet in verge of research, and we are about to come with a new molecule which is extracted from the rice and which has an anti-cancer property. And other than that, green tea extract, which works wonderful in colorectal cancers. And medical cannabis, as we in Ayurveda we call it as a Vijaya. And medical cannabis, which we consider which has a, cannabinoids, and which works on the endocannabinoid system, which improves the appetite, reduces the anxiety, and which helps in, controlling the pain effectively in majority of the time when a terminal, bone metastasis cancer patients. I use very high dose of medical cannabis, where I see that it reduces the anxiety and depression, gives patient good sleep with effective control over the pain and boosting the metabolism and, improving the appetite and all. Next slide. Next slide. Next slide, please.
Just a second.
Yeah. Yes. So other than that, ginger, bhumi amalaki, triphala, tulasi, amalaki, eranda karkati, dadima, shilajit, draksha, as I said, grapeseed extract, lakshmana phala, which is a annona muricata, which we call it as a graviola or the sour soup. So these have been, I am using extensively for multiple cancer in one or the other form, either in the drops or in the tinctures or in the capsule form. And tremendously. This has been boosting the immune system and controlling the disease, and I can see good improvements blood report wise, and also controlling the cancer activities. Okay, next slide. Previous. Yeah. So other than these Ayurveda herbs, what we use, I prescribe, this is considered to be, nutraceutical ingredients. So these omega-3 fatty acids, N-acetylcysteine, alpha lipoic acid, I do selenium therapy, coenzyme Q10, silymarin, glutathione, enzymes, saw palmetto, which is called Ceronia repens, and the shilajit, spirulina, amino acids. Okay. See, one more thing I want to tell you is there are good lot of drugs which have a better control over the disease, but where majority of our drugs fails is, one is the quality and second is the purity. Okay. See, I use a curcumin where I import it from the UK. Okay. So it has made with a different technology, but majority of the curcumin may not be absorbed by the body. So when you give it a right dose, right purity, and with a maximum active principle, there is a high chance that it works much, much better than any allopathy ingredient or the allopathy drugs. Okay. So where majority of the Ayurveda fails is, we don't know how to select the right medicine or probably the right ingredients, and we don't know the what is the active principle. So since my post graduation in Dravya Guna, so that has been a boon for me studying Dravya Guna, and that is I am using Dravya Guna knowledge in understanding the research and the formulation development, understanding the ingredient, understanding the active principle, and understanding the right amount of the active principles. For example, I want to tell you, see, when we treat or when we prescribe some drug, Ayurveda drugs, always we should look into two, three things. One is from where it is originated. Example, Withania somnifera is the original species of the ashwagandha. Okay, majority of the time, if the ashwagandha is or the roots, we usually use ashwagandha roots. Okay, the Withania somnifera roots. But to avoid the cost, to save the cost, this root is adulterated with the stem. Okay, and instead of Withania somnifera, majority of the company uses Withania fructiscens or Withania coagulans. So there we are losing the efficacy of the drug. That is one thing. Second thing is, we may not be providing my, if you take the selection of my ashwagandha will be Withania somnifera roots. Okay, and it is a original species, not Withania coagulans or Withania fructiscens, but the maximum active principle of withanolide in that is 7%. But 7% is little expensive, so majority of the company uses 3%, 4%, or 2.5%. So where you will have to give the almost 3 times or 4 times the prescribed dose, which practically difficult for the patients. And if you give with a normal dose and with a under purity of the drugs or the under activity principle, majority of the time it may not work, and we may fail in giving the desired result to cancer patients. So always I make sure that to read the ingredients properly on what I prescribe. One. Second is to read the source, whether it is a genuine source, and to know about the useful part, whether they have used the roots or the stem or the stem bark or the flowers or the fruit. And third is the active principle. What is the percentage of active principle is involved? So when we focus on this, and when we prescribe a very authentic products, definitely, I am confidently, I can tell you that these medicines and these molecules can works better than any allopathy ingredients, which I personally and practically I experience in my OPDs. I use a ashwagandha product, which is a 7% withanolides, and it is a supercritical extract, and the roots is used original species. I can confidently tell my patients that within 3 days your neuropathy will come down. because many patients complain of peripheral neuropathy, severe neuropathy after chemotherapy. If I prescribe one ashwagandha capsule 500 mg 7% withanol, a patient can significantly feel improvements in terms of reducing the neuropathy by almost 50 to 60%. Not even gabapentin or the whatever they give for the neuropathies, gabalin, pregabalin, gabapentin, even these drugs may not work. So this point one, which I wanted to highlight, that whenever we are practicing, please make sure that we select the right ingredient, right source, and right purity and the right dosage. Then only you will see early recovery and early results. Okay, so other than these herbs, I use multiple these nutraceutical ingredients. Even though, see, even in omega-3 fatty acids, if you give 300 mg, 400 mg for the cancer patients, definitely it may not work, because the research says that I need 2 to 3 grams of omega-3 fatty acids to reduce the inflammation significantly and to boost the immune system. So I give high potency omega-3 fatty acids from 2 to 3 grams for a cancer patient, where I see that in a span of 3 to 4 weeks, the CRP level will be controlled, HSCRP will be controlled. Okay. Next slide. So, and these are the treatments which I usually practice in my hospital for the cancer. One is Ayurveda, as I mentioned, all the Ayurveda herbs. And in Ayurveda, I use few rasaushadis, okay, like Hiraka Basma, Thamra Basma, but very limited prescription of rasaushadis. And Ayurveda, since I am a Dravya Guna, I give Ekamulika Prayoga and a single herb extract with maximum purity, and that has been again my strength in treating the cancer successfully. And second is medical cannabis, where where I give company to have a my own customized formulation. The medical cannabis what I use is has a cannabis. Along with the cannabis, I use grapeseed oil, ginger oil, ashwagandha, so that kalamega, so that I am improving the appetite, improving the metabolism, and reducing the stress levels in the body, and improving overall protecting the liver. So always there is a scope of customization, and multiple titrations, permutations, and combinations we can do as per the patient's requirement or the need. And ozone therapy, no doubt, it is considered to be, as I said, one of the powerful tool in terms of IV treatment. Very rarely chelation therapy I use for the cancer patients, and again high dose IV vitamin C therapy, which I have seen significantly where the too much of inflammations. I usually go with a high protocol of high dose vitamin C therapy. IV nutritional therapy, which includes I give dipeptidyl, amino acids, omega-3 fatty acids, L-carnitine, N-acetylcysteine, etc. Again, IV anti-aging therapy. This is where I see that malnourishment, and again to give L-tyrosine and L-carnitine and glutathione and all these to stimulate the antioxidant enzymes in the body. Nutraceuticals and dietary supplements, as I mentioned in the previous slides. And regenerative medicines, where there is required, I also use stem cells and PRP therapies and hydrogen inhalation therapies in terms of to prevent the lung infection because of the chemotherapy or because of the high steroids, and to improve the tissue oxygenation in the brain in terms of brain tumors and all. So these are the multiple treatment approaches which I integrate my cancer patients. But only drawback is majority of the time patients approaches with a lot of complications, and after completing exhausting all the treatment, still with this integration I see good amount of benefit. Many a time patient approaches with saying that my oncologist has given 1 month 2 months time, but with these kind of approaches I could successfully able to keep patients survived up to 1 year, 1.5 year, 2 years, from 2 months 3 months, with a healthy and intact quality of life. Okay, if they come early, I know that definitely I can reverse the cancer, and I have reverse the cancer from stage 4 to stage 3. And you can see in the future slide how my patients' reports are with these therapies. Next slide.
So, Dr. Lalit, sorry for interrupting. I
Yeah.
feel we'll take some case studies due to the time
Yeah.
constraints.
Yeah. Next is the case studies only.
Okay.
Yeah, this is again which we are at the verge of the research, and this is called PDT, where we are using photosensitizer. We are infusing the photosensitizer, and we are giving the different lights of wavelength, which arrest the blood supply to the tumor, and thereby the tumor get necrosed or the shrinks. So next slide. Yeah, next slide. Next slide. Yeah. So let us quickly go with the case studies. You can see that this is a case of non-Hodgkin's lymphoma, 55-year male presented with increased bilirubin levels, okay, liver cirrhosis, post multiple chemotherapy. So this patient has approached literally with no options because he has exhausted all the options. And even our oncologist, the hospital where I practice, said that nothing can be done, only immunotherapy can be done. That too cost with a very huge cost. Okay, and this patient approached me, and even the oncologist approached to say to do something with the Ayurveda. Okay, so you can see the report here. The bilirubin level was 14.8. Okay, and you can see the date there, January 9th, I think. Okay, and you can see the down report. It is January 15th. Okay, or probably in a span of 10 to 15 days, you can see that bilirubin levels, how it has been drastically reduced and how the liver has been survived. Okay, so it is only a span of around 9 to 10 days, or probably maximum 2 weeks, when the patient has lot of symptoms related to the hyperbilirubinemia, breathlessness and ascites and all. With simple Ayurveda medicines, in a span of 10 days, you can see that how the bilirubin has been reversed. Next slide. So the treatment was, there is something called capsule liver. Okay, this is my combination only, and my company produces it. Okay, so where I have put Bhumi Amalaki, Daru Haridra, Bringaraja, Silimarin, and aloe vera. See, this is why this is a simple herb, and this the concept behind this is a very pure extract using a virginal source and a pure maximum purity. Just by giving one capsule live over 500 mg, one QID, that is 4 times a day, can give this kind of a significant improvements in terms of reversing the bilirubin and also reversing the liver enzymes. Okay, next slide. Second thing, case of GBM. Of course, they have come at a very later stage. They have taken all the possible treatments like chemotherapy, radiations, and also it was done surgery for the glioblastoma. And the patient presented with recurrent infections, continuously fever, with low because of the low WBC and liver dysfunctions. Because of the side effects of chemotherapy, when the things are nothing happening, they have approached me. You can see the result. Next slide. See, you can see that um, on July 20th, you can see their enzymes, liver enzymes. Okay. So the liver enzymes was SGPT was 316 and SGOT was 193, which is almost 3 times more than of normal this thing. Okay. So you can see July 20th, it was 193 and 316. If you see the down reports, within a span of 3 days, using Ayurveda and the herbal molecules, the amount of liver enzymes which has been reduced. Okay, you can see SGOT came to 83 from 193, and SGPT 176 from 316 in a span of 3 days. Okay, and this has been not possible with any allopathy treatments which already our oncologist was giving. When nothing is happening, everything was failing, patient approached me, and in a span of 3 days, we can able to do such a miracle results in our patients with liver enzymes. Okay, again you can see that the total WBC count was 1500. because of which she was suffering from recurrent infections and the fever, and she would have ended up with the sepsis. But with the same medicines I have given, her WBC counts, you can see that, in a span of 3 days, it has been increased to 7,200, from 1,500 to 7,200. Okay. This results, I don't think any of the allopathy ingredients or the allopathy drug can give this. Okay, that too at this stage. Okay, and let us see what the treatment I have given. Next slide. So capsule liver, as I explained earlier, which has a combination of Bhumi Amalaki liver and etc. And I have given Giloy Sattva. See, Giloy Sattva is one of the beautiful Ayurveda medicines which I prescribe for my all the cancer patients who come with the bone marrow suppression. So once the bone marrow is suppressed, even by giving WBC injections, platelet infusions every other day, still your body may not be able to keep it or sustain it, because there will be always destruction of these blood counts. So when you stimulate the bone marrow, automatically you see that you are increasing the blood counts and you are keeping that sustainably at least for a few months and few weeks. Okay. So and tablet vitamin C 1000 mg, 2 tablets per day. Okay, so these are the treatment which I followed. Of course, this is not a fully cancer treatment, but when the patient come with fever recurrent, this is like more of symptomatic treatment, at least to come out of the complications, and then the next step will be to focus on the cancer treatment. Next slide. See, case of CA oropharynx with lung metastasis post chemotherapy with severe lung infection. This patient was admitted in the ICU with recurrent fever, anemia, and severe lung infection. Okay, and oncologist, they said that it is a stage 4, no radiotherapy can be done. They have given chemotherapy, and after chemotherapy, after the side effects, this patient has approached me, and I have given the treatment like ozone therapy and high dose vitamin C therapy. You can see the report. Next slide. You can see during a IV antibiotics, his CRP level was 84. And after IV antibiotics, you can see that CRP was 76. Okay. And once I started this IV ozone therapy, so in a span of, you can see that is a 7th March and this is the 29th March. In a span of 3 weeks, you can see the amount of CRP which has been reduced. So once you are controlling the CRP, it is obvious that you are reversing the cancer disease. So this was the stage 4 cancer case, and which has come to me. I have done the ozone and vitamin C, and after 3 months of time, I have gone for a PET scan, which has come to the, you can see that almost all the lung nodules has been reversed, all the cervical lymph node has been reversed. Only in the primary site, there was a 60% cancer was remaining. But other than that, whatever the secondary cancer was there, everything was localized, along with the good control in the inflammations and the blood levels. Next slide. See, this is one of the very interesting case which I want to highlight is, this is a case of CA ovary with peritoneal and omental metastasis, significant ascites. 2 times the ascitic fluid tapping was done, almost 2 liters, suggested 3 cycles of chemotherapy, then surgery, and again 3 cycles of chemotherapy. And this was referred by my colleague, and this patient has left everything without chemotherapy, radiotherapy, and surgery. Only 2 times ascites was tapping, and they left everything and they started my treatment. Now you see how the Ayurveda and integrative therapy was. So initially, before starting my treatment, the CA125, which is a ovarian cancer marker, was 247. You can see the date also there. It is in the 26th March. Okay, and I started the treatment by somewhere around the April 1st week, that is a April 11th. Okay, and I have given ozone. I will explain you what are the treatments I have given. So you can see in the May 11th, CA125 has reduced to 198. Okay, and in June 12th, you can see that CA125 has reduced to 69. Next slide. And in July 15th, CA125 has came to 22, and in August 14th, CA125 has came to 15. Okay, see, this is one of the very accurate marker which normally we consider it as in allopathy. Okay, so you can see that when we don't damage the body, when we stimulate the immune system, and when we keep the internal atmosphere very healthy, automatically you will see that all the cancer markers are reducing without damaging the body. And I will also would like to tell you one thing, that it has been 1.5 year. This patient has not lost even 1 kilo of her weight. Okay, and not even 1% of hemoglobin. Her liver function is completely intact. WBC, platelet, everything is perfectly all right. Along with that, CA 125 has been brought down from 247 to 15 in a span of 4 months without any allopathy treatment, not even a paracetamol. Okay, and next slide. See, you can see that this is a PET scan report. The earlier report was done in April, and the later, the down report was done in August. Okay, you can see that wherever the peritoneal nodules, ovarian tumors, and the mesenteric lymph nodes and the ascites was there, pericardial effusion was there, and minimal pleural effusion was there. You can read the report there. Mild interval increase in the size of ovary, but interval resolution of metabolic activity. Interval resolution of metabolic activity and regression of previously seen omental thickening. Interval resolution of mesenteric lymph nodes, interval resolution of ascites, pericardial and pleural effusion, and no other visceral. You can see that the report, how the crystal clear report is. SUV values was there. You can see it is ranging from 5, 9, and 12 and 2 SUV. But after my ozone and vitamin C, nowhere you can see that SUV, everything has been regressed. Okay, even with allopathy treatment, you will see that SUV values are from 12, it can go to 3, 4, 5. But with ozone therapy, you can see that wherever the cancer activity was there, everything has been regressed. And this patient, I can say that completely she has reversed her cancer. Okay, the treatment followed was high dose IV vitamin C therapy weekly once, ozonated therapy weekly twice, IV omega 3 fatty acids monthly once, and supplements like CBD oil, as I said, alpha lipoic acid, liver, selenium, and tablet sodium copper chlorophyllin 1 per day. Okay, so basically these treatments aim at maintaining the, boosting the immune system, to have a good, better fighting immunity towards the cancer, and controlling the inflammation, improving the appetite, improving the metabolism, to have a good, to give a good stimulate to the organs, so that this case was managed successfully without damaging and completely reversing the cancer. Next slide. So these are the few of the testimonials of the cancer patients, which you can go through the later. Okay, I don't want to go in deep. Next slide. So research paper of few commonly prescribed Ayurveda herbs and anti-cancer property. As I said, no, as I have mentioned, no, the few of the herbs which I prescribe for the cancer, this has been same highlighted with the research. So in that, curcumin is there. Next slide. And ashwagandha. So these are the potent anti-cancer herb which I use regularly in my clinical practice. Ginger, next slide. So hepatoprotective Tinospora cardifolia, which is a very good bone marrow stimulant. So I use wherever I see the bone marrow suppression is there, the first drug of choice will be Kuduchi. Next slide. So the main 5 tips for successful cancer treatment, which I follow for my patients, is effective anti-cancer supplement. It is not that curcumin is good and you give. No, you have to select a right curcumin, right dosage, right strength, and the right purity. Okay. This holds good to all other Ayurveda herbs and nutraceutical ingredients. Even though I select a right herb, but the dosage is under dosage, if the the purity is not good, then probably we may not give the expected result to the patient. Stimulating the immunity against the cancer naturally, protecting the organs from toxicity or the chemicals, maintaining the healthy atmosphere in the body, and no side effects or minimal side effects. So these 5 things can be achieved by integrating treatments, by ozone, by vitamin C, and by our Ayurveda and naturopathy. But none of the available conventional treatments can do these 5 things. That is why always there will be a chance of reoccurrence. There is a chances of higher toxicity, adverse side effects, and the metastasis, and reduced quality of life, and the poor prognosis. Next slide. Next slide. So with this, I conclude my talk, and once again, thank you all GCAR members, directors, and volunteers for giving me such a wonderful platform to share my experience. I agree that this is a very small session, which I hope many of the expertise are also there in the platform. So somewhere, if I have gone wrong, or I have somewhere if I have would have been not used the right words, I apologize. And this is a very small my experience with around 10 years of experience, but still lot to do in my field. And I hope it was interesting, and it was a informative talk.
Dr. Lalith, it was interesting and informative both, because I see the participant was raving about your presentation. So this is, if anybody has any questions, the participants, you can ask those questions right now.
Yeah, any questions are welcome.
We'll take the questions one by one.
Hello.
Yes. Yes.
I congratulate Dr. Lalith Kumar for an excellent and informative presentation. It was a very unique and holistic approach through Ayurveda in prevention and curative purpose of in cancer. I would like to know something about, like, you mentioned a lot about of nutritional supplements and nutrition to the cancer patients. So I want to know whether you have any specific nutrition interventions to your patients in differentiation of different cancers and body metabolism and BMI of a patient. Like, for example, if a patient is very thin and very weak in his or in her BMI, and if a patient is very obese, do you have any specific nutrition diet chart or anything in your practice?
Yeah, of course. See, if the patients are very weak, I approach basically giving little high protein diet, okay, and giving something, more of IV amino acids to improve the, muscle energy and the muscle bulk, and to improve the, the cellular energy levels. At the same time, if the patients are obese, I go for a high healthy fat diet. Okay, and also I include a herbs or the drugs which are anti-obesity and which is a lipid metabolizer. Example, you can say I can use a green tea. Okay, so green tea is to be considered as a very rich in flavonoids, very rich in catechins. Okay, at the same time, this green tea is a very potent anti-cancer. Okay, so depending on the disease, and depending on the body metabolism, depending on the BMI, and depending on the physical appearance of the patients, of course, there is always a scope for customizing. This is called customizing. So when they are obese, I give something like, which is helping them to control the obesity and control the BMI, control the, to improve the lipid, metabolizer. Along with that, I see the herbs which are anti-cancerous. Simple example is green tea. Green tea is very good lipid metabolizer, very good for obesity. At the same time, it is an anti-cancerous. Okay. And coming to the weaker, example I can give Shilajit. Okay, Shilajit can improve the metabolism. Shilajit, Ashwagandha, Shilajit and Ashwagandha can improve the metabolism, can improve the muscle bulk, can give some good strength to the patient. At the same time, this can be a very good anti-cancer also.
Okay. One more thing, I'm hearing a lot of research regarding quinoa as an anti-cancerous grain. Yeah. So what is your approach on that grain?
Yeah, see, quinoa till now we have not used as a medicine.
Mm.
Okay.
No, in the dietary
Yeah,
supplement.
as a dietary, but quinoa is not only for the cancer. I usually recommend for all the GI related issues because quinoa is considered to be good in fiber.
Yeah.
Okay, so irrespective of cancer, as a dietary supplement, it is always good to take quinoa or include quinoa in our diet. It is for prevention also and also for the cancer. Other than cancer also, if they are suffering from any of the diseases, quinoa is one of the good option to include in the diet.
Yeah. Okay. Thank you, Dr. Lalith. Thank you.
Thank you. Thank you.
Thank you, Anita, for asking those questions. So, is there any more questions? Please come unmute yourself and please ask the questions. I think we don't have any questions. So, thank you sincerely for such an informative and insightful presentation, Dr. Lalith. I knew that you're very successfully practicing, and this will be a very informative session for our audience as well here in United States. And thank you everyone for attending our webinar. Please watch and subscribe to our YouTube channel to view earlier webinars and other presentations. So please like, subscribe, and comment and share the videos. Once again, I invite you all to become a member and also fill out our volunteer form. You can also subscribe to our IU Update newsletter to stay tuned to our projects and events. If you have any questions, feel free to contact us at Ayurveda Research USA @gmail.com or dr.pragati.hegde@gmail.com. Thank you all.
Thank you. Thank you.